Hi everyone, welcome to my vlog, and I would like to share you about my journey of my diagnosis. The reason why I've been quiet to my FB uh, FB account, and I would like to apologize to all my friends, relatives around the world, and any of my colleagues who doesn't know what has been happening to me. And I apologize as well for not answering uh, some of your messages on the messenger. um, it's because of this journey that I am going to share with you. Hi, I'd like to share about my journey regarding my diagnosis. So it was actually the first week of September last year, 2020, when I felt something on my breast. But the first thing I have experienced is itchy. It's very itchy, my right breast. And it's and after 5 days, I felt a lump. And Monday, I felt something. And then Friday, I felt the lump, which is a bit sore. It's like there's some milk that's been as if you're breastfeeding. And then I can tolerate the pain, but I felt that the lump that I feel is moving. So I was quite worried. So I still work on that day. And then on the next day, that was Saturday, I woke up with severe pain. And my right breast was quite swollen. I feel that it's swollen. It's like full of milk that I'm ready to breastfeed. And it was 3 o'clock in the morning that I was really feeling severe pain. And I still went to work. And then at work at around 11 a.m. I feel I can't tolerate the pain. So I went to A&E and registered myself. And I have been seen and then been discharged. I've been given, I've been advised to have pain, although they have done x-ray, bloods to rule out any infection and everything. And it was all negative, but they can feel the lump. And the consultant, I've spoken to the consultant, and he said, of course, medical consultant, he said that it's moving, so we're not worried about that, but we're going to refer you to to the breast clinic. So I went back to work, and it's good that my colleagues, and I really thank uh, some of the A&E staff that's been very helpful to me, and especially Kuya Edwin, uh, uh, Kuya Edwin Balarao. He was very helpful to me when I felt. I think he was so empathetic on how he was so his empathy was really very good to me. He knows, and he was the one very helpful to me. Although I have a lot of Filipinos in A&E where I am working, but he was really very good to me, and I really thank you, Kuya Edwin Balarao, for your help on that day, and one of the radiotherapy in the in the city something a city department. So the consultant said they're not worried because it's moving, the lump is moving, but I'm a little bit worried. So I really asked him if they can do emergency appointment for my breast clinic. So they did the referral. And I waited for the referral. I thought it will be like next week, but it said maybe it will take a week. So I went to forget this thing, because I was a little bit worried. I went to visit a friend in Germany, and when I came back on that Monday, that was September, I remember it's I think September 26 or 27, I had a breast clinic appointment, and the consultant told me to go and have a mammogram. So I had a mammogram, so you can see on my clips, on my videos, that I had a mammogram. And it was really, and the sight on that day, it was really, they want me to do, like, I think they were quite worried because the first mammogram, they're quite, they're not sure. So they did another second mammogram. I think women who had already, how it's very painful, especially if your breast is very small, and the way they squeeze it, the way they pull it and everything, and, for 4 times. So the second time they told me, and I was quite worried, because I said, what's wrong, And the third time, they told me to have another, because and then the consultant have spoken to me and said, we're a little bit worried, so we want to do another mammogram. That's all in the same day. And then I said, okay. Then they did something. It's like, after the mammogram, they did like another scan, and then they told me I have to do another fourth before they do the biopsy. So I agreed because it was really painful. On the third time of mammogram, I wanted to give up, but I said, okay, if really you want to know what's best that we can do for myself, then I'll go ahead. So I did for the fourth time, and I was so in pain. I was really, I was crying, and I really want to have, my painkiller, which I didn't bring with me. So, but I had to go through all this in order for me to know, really, or to rule out anything that's really, the question that they can't really, find. So I did the fourth mammogram, and I was crying, and then they did the biopsy. After having the fourth mammogram, they did the biopsy, and they wanted to do again a mammogram, the fifth mammogram after the biopsy. You know how biopsy was. I was so much in pain, and you can see on my clips that I have all these sores. And how many, they have three parts where they took the biopsy. And I said, if you will put me to sleep and do the mammogram for the fifth time, I will agree. But at the moment, I couldn't. I already agreed because they want to do like biopsy for twice. And I said, you have already started it, because they did 3 on my lower breast, and then on my left side. On the second biopsy, because they have to do like 3, I don't know, it's like a gun inside my, breast, that, and it was so painful. On the second biopsy that they did on my left side, on my right breast, it was really painful. And they said, will you be able to do it again on, they want to take it from my my lymph nodes. They want to check, because I think, they want to check on my lymph nodes as well, because they thought there's in my lymph nodes as well. So I said, I'm going to tolerate the pain, because I don't like to come back again to do another biopsy just for my arms, under my arms. So they did it, and it was really painful. And they asked me if I can have the 5th mammogram, and I said no. Unless you put me to sleep, I will be able to have the the mammogram, the 5th mammogram. So after this thing, it all became positive that I have a cancer. After a week of my mammogram and my biopsy, I've been called to go and see my consultant, and then they told me I have a breast cancer, which is below my breast, right breast is positive, and then on my lymph nodes, they underarms, they say there's they have seen another positive node with cancer cells. So I have been blatantly told that I have a cancer, and I know it was devastating for me. I cried, not in front of the doctor, not in front of my daughter, but in the toilet. I did cry over there for quite some time before we went home. And first, you can't accept it, because how much active I am working, it's quite difficult to accept it. But the end, I all entrust everything to God. After that, it's a little bit, you know, for the first week, 2 weeks, 3 weeks, I was not really uh, accepting, you know, or taking it in everything. So uh, with the continuous, you know, appointment with my plastic surgeon, breast surgeon, and everything, it was really a thing. And because of the COVID, I I was told the risk of having all this surgery. So you can see as well on the clips, on my clips, that I had my uh, right mastectomy and reconstruction, wherein they took a flap on my abdomen and then put it on my breasts, because they have given me choices actually, if I could have a silicone implant, or you know, or the flab, so reconstruction. So I choose reconstruction, and I choose to have it all in one go, because I don't like to you know, to do like mastectomy and after 6 months I'll have again the reconstruction. So if it's possible to do like in one go, then I'll have it. So I did have it, and you can see the clips after. This is my drain from abdominal and axillary. It's connected. This is one. Still draining though. Thank you very much for watching, and the next vlog that I'm going to share with you guys will be my journey to my chemotherapy. Thank you guys.